What is a complete pathologic response? I'm a fellowship-trained breast surgical oncologist. I'm Dr. Amani Jambakar, and let's talk about it. I made this picture to represent a cluster of cells inside someone's breast cancer. You can see there are a lot of cells and they're densely clustered together. For some patients with breast cancer, especially those with stage 2 and stage 3 cancers, systemic treatment, meaning something like chemotherapy plus or minus immunotherapy or HER2 blockers, are recommended before surgery. So let's assume that this patient got one treatment. This image represents what the cells look like after one treatment. So if you were to do another biopsy of this patient's breast and to look at these cells under the microscope, you would see that there are fewer of them, meaning that the treatment is working. This is after all of the treatments have been completed, which is usually 4 to 6 months, and this is what we call a complete pathologic response, where you can see that there used to be cells in the area, but there are no live tumor cells left. And this is a patient who you would have seen that either on their ultrasound or on their MRI, they had no evidence of a tumor left, when it was pretty clearly seen before they started treatment. We find out that someone's had a complete pathologic response after surgery when we've removed the entire tumor in either a lumpectomy or a mastectomy and looked at the whole thing under the microscope and verified that there are no live tumor cells left. And having a complete pathologic response means that the chance that the cancer is going to come back is very, very low. This is a graph which was published in a JAMA article from 2020, which shows distant recurrence-free survival in patients with and without a complete pathologic response. Distant recurrence-free survival means that the percentage of patients whose cancer did not come back somewhere else in the body. The black line on top are the patients who did have a complete pathologic response, and at 3 years, 95% of them did not have cancer come back somewhere else in the body. The orange line is patients who did not have a complete pathologic response, and at 3 years, only 81% of them had not seen the cancer come back somewhere else in the body. So having a complete pathologic response, or PCR, is a great sign that the cancer is not going to come back.